Hi class. This week we're going to look at environmental safety. What is environmental safety? Identifying and correcting potential hazards that can cause accident or injury. You will want to remember the acronym OSHA, which stands for Occupational Safety and Health Administration. OSHA will come into healthcare facilities and hospitals a few times a year to make sure that the fire alarms are working properly and that the fire exits are open and not blocked once the inspections are done. It is OSHA's way to say that the facilities are safe and are environmentally safe for the patients and their families and their staff. General safety guidelines, OSHA standards, workplace risks. They're going to look at your disaster preparation, safety data sheets or SDS, injury prevention, use of body mechanics when lifting and moving patients, green cleaning agents, slips, trips, and falls, making sure you clean the floor if you spill something or note something on the floor, wash only half of the floor at a time, use appropriate ladders or step stools to reach the cabinets, ambulation devices, and workplace violence. You're going to want to remember this acronym as well. I think this is a great visual slide. It's RACE. RACE stands for Rescue Patients and Coworkers. A is for Alarm, Alert Appropriate Officials. C is to contain or confine the fire. E is to extinguish the fire. Always know your escape route. Are the extinguishers A, B, or C, or D? And you can look over this chart that I have attached here below. This is another acronym that you're going to want to remember. When using a fire extinguisher, PASS. The P is for pull the pin. A is for aim the nozzle at the base of the fire. The first S is squeeze the handle. And the last S stands for sweep back and forth along the base of the fire. The last slide is on workplace violence. Workplace violence is violence or the threat of violence against workers. Workplace violence can occur outside the workplace. It can range from threats and verbal abuse to physical assaults and homicide, one of the leading causes of job-related deaths. However, it manifests itself. Workplace violence is a growing concern for employers and employees nationwide. OSHA is in charge of making sure that this does not occur at your healthcare facility. Couple bullet points here just to keep in mind when safety in the workplace. Know your surroundings. Avoid traveling alone into unfamiliar locations or situations whenever possible. Assess the patient and their family for violence. Pay attention to your surroundings to make sure that when you go into a patient's room that the family's not yelling at each other. Pay attention to the family and their dynamics and how they are responding to each other. Always report any issues related to inappropriate discussions. Determine the need for intervention. Keep your patient safe. Learn how to recognize, avoid, or diffuse potentially violent situations by attending personal safety training programs. Anytime you become employed through a healthcare facility or hospital, they will have you do online modules each and every year to make sure that you know how to protect yourself in the workplace. Always alert your supervisors to any concerns about safety or security and report all incidents immediately in writing. Carry only minimal money and required identification into community settings. When I worked in the hospital, I remember one day there was a couple of us, we were walking out. It was a beautiful sunny afternoon in the middle of July. The one girl was walking ahead of us because she had an appointment that she needed to get to. And when she was walking out, she was approached by a stranger that was underneath an underpass bridge, and he ended up robbing her. We could not do anything to help her at the time because she was already across the street and at least a few blocks down. We did notify security, and thankfully she wasn't hurt, but she did lose all of the valuables, including her pocketbook. So always carry just minimal, basic backpacks with you and minimal money, credit cards, and so forth.